Planned care is really about going to see the specialist at the hospital, so going for your outpatient appointment, or going into hospital to have your operation done, which is a planned thing, not an emergency rushed-in job, or perhaps having an X-ray test done, going and having some investigations done. So all of those things that you sit down with your GP and work out what you need to do next, and then it's planned and you have an appointment for it, and then the hospital sorts you out and does that for you. So that encompasses planned care, and it's those elements we've been looking at in the group I'm helping to co-chair. I think really we recognise that services have grown up over time within the NHS, and things develop naturally that way, but often they don't fit together in a very sensible way for patients. And this is a really good opportunity for us to sit down and try and be strategic, to look at how things fit together and to try and get the very best for patients, so that, yes, they're what we might call a patient journey, referral from GPs into hospital, and all the communication in between works out as smoothly as possible so that they get a really high quality experience when they need NHS care. I mean, as a GP, I obviously sit with my patients day in and day out, and I'm trying to get the best for them in terms of their care. Initially, I do that with what I can offer them within my practice, but often I need to turn to my colleagues as experts in the hospital. And so getting this right is about getting the access to those specialists to be as easy as possible, perhaps having care as close to home as possible so my patients don't have to travel too far, and also having the access fairly quickly as well. Sometimes we want that specialist opinion sooner rather than later, and so getting this right helps it to all work efficiently, and yeah, it makes my job easier because I have happier patients who are healthier. I mean, I think patients will often understand what quality means. For them, it means being treated with respect, and people offering their very best in terms of giving them advice that's tailored to them as an individual, helping them to make choices, and see the way forwards for their health. I think in terms of these working groups, it's working out how where services are fits with what patients need and want and expect, and it's working out how that can be delivered in a way that's smooth for them so that they can get their appointments in a way that's easy to do. I mean, I think there's a real challenge here for us. We recognise that unless we all want to pay more taxes in this country, that there's only so much money to go round, and that has to pay for the NHS. So we have to do things in a more efficient way in every way that we can, and strategic planning is a really important way to try and achieve that. And as GPs and as other doctors and nurses, we're very happy to work with the hospital here and the hospital trust to try and see how they can make things fit together so that it works efficiently, so that it costs less in every way that's possible, but still offers a really high quality of care for patients, which is what we all want, because we're patients too. And we want to offer a really good service and have a really good service there for us and our families too. So that's at the centre of what we're doing.